So, good day, Ma'am Ilugun. I choose healthcare because healthcare in the Philippines faces numerous challenges, including inadequate access to medical services, can't afford private hospitals, and disparities between urban and rural healthcare access. So, despite the implementations of policy like the Universal Healthcare or UHC, Republic Act number 11223 Act in 2019, millions of Filipinos still struggle with accessing affordable healthcare. So this is especially true for low-income families, those in rural areas, and indigenous communities. So the Philippine healthcare system is also burdened by insufficient numbers of healthcare professionals and underfunded facilities. So, therefore, comprehensive healthcare reforms is necessary to ensure that all Filipinos, regardless of their socio-economic status, can access affordable and quality healthcare. So, this issue demands an urgent policy solution to improve access, reduce cost, and enhance overall public health outcomes. So, by using the main stages of public policy process, I would start by the agenda setting, which is to effectively address healthcare reforms in the Philippines. I would start by conducting public awareness, campaigns and organizing forums, and engaging media outlets to highlight the flaws in the current system. Partnering with the NGOs, health advocates, and amplify the urgency of the issue. Collecting data from underserved communities and health service would strengthen the case for reforms by demonstrating the widespread impact of healthcare access issues. So second is the policy formulation, which is in this stage I would work with the stakeholders such as the Department of Health or DOH, healthcare professionals, policymakers, and health economists to develop policy proposal. So for the third stage of policy making, which is the policy implementation. So in this stage, by implementing healthcare reforms in the Philippines would include the DOH, PhilHealth, local health units, and the regional health offices. So I would collaborate with these bodies to ensure the effective rollout of policy. So in addition, health workers must be trained, and the systems for monitoring the distribution of healthcare resources needed to be strengthened for a good and quality services for the low-income families and for indigenous communities also. The next stage, which is the policy evaluation. So, in evaluating healthcare reforms, would involve collecting data on healthcare usage, patient satisfaction, cost reduction, and health outcomes. So, this could be done through surveys, interviews with healthcare providers and patients, and tracking health indicators such as infant mortality rates, life expectancy, and the incidence of preventable diseases. So, collaboration with the independent research bodies and universities could help ensure that evaluation are objective and data-driven. So, bureaucratic organizations such as DOH or Department of Health, PhilHealth, local government units or LGUs, and National Economic Development Authority or NEDA. So these bureaucratic organizations are essential to both implementing and evaluating healthcare reforms in the Philippines. So here's how they would contribute to the healthcare reforms. So in implementing, DOH is responsible for creating national health policies, overseeing public health programs, and ensuring that reforms are carried out nationwide. So it would be important or crucial in guiding the distribution of resources and ensuring the proper implementations of healthcare reforms at the national and local level. So, PhilHealth, this government-run health insurance program plays a crucial role in expanding healthcare coverage. So, under the Universal Healthcare Act, PhilHealth would be the key in ensuring that marginalized and low-income populations have access to affordable health services. And LGUs, also local government units, are at the front line of healthcare delivery. They would be responsible for implementing healthcare programs at the community level, ensuring that health facilities are equipped and accessible in mobilizing healthcare workers. And the last one is NEDA, which is the National Economic and Development Authority. So this government or organization is responsible for aligning healthcare policies with the country's broader economic and social development plans. So it ensures that healthcare reforms are adequately financed and that they align with other policy goals such as poverty reduction. DOH, PhilHealth, NEDA, LGUs. So this agency would also be involved in monitoring or evaluating the success of healthcare reforms. They would collect data on healthcare utilization, quality, and patient outcomes to assess whether reforms are meeting their targets. So they would be involved in evaluating the effectiveness of medical technologies and devices implemented through healthcare reforms. So in every policies, there are challenges that you will be facing off in healthcare reform, such as inefficiency and bureaucratic red tape. So the challenge here is that the Philippines bureaucracy, like many others, can be slowly moving, inefficient, and prone to corruption. So this can delay the implementations of healthcare reforms and lead to misuse of resources. So what strategies would I use? What strategies would I use? So to overcome this challenge, I would push for streamlined administrative processes, ensuring that there are clear timelines and performance metrics for each stage of policy implementation. So, in conclusion, healthcare reforms in the Philippines is a complex issue that requires careful planning, effective policy implementation, and through evaluation. So, by engaging key bureaucratic agencies such as DOH, PhilHealth, and LGUs, so we can ensure that reforms are executed efficiently and that healthcare access is improved for all Filipinos. Overcoming bureaucratic challenges like inefficiency, resistance, and fragmentations will require targeted strategies such as a streamlined process, strong stakeholders engagement, and interagency collaborations. So with the right policies and management, healthcare reforms can significantly improve public health outcomes and the quality of life of Filipino people. So that's all, and thank you.